He has gotten, along with his family, vile emails and even death threats. Trump advisor Steve Bannon has said he should be beheaded and his head put on a pike outside the White House. Would you accept a preemptive pardon from President Biden if it were offered to spare you what they might do? What about your relationship with Congress, where I think you last appeared in June of last year, your final appearance before your retirement, where they were all but again calling for your head. And at one point you said that if anyone's lying here, you're the one who's lying. And you were addressing that to Rand Paul, who was mischaracterizing not only your point of view, but the science. So what is up with Congress and you?
I've been testifying before Congress with every outbreak that has occurred since HIV back in the 80s. And I think it's without hyperbole. I probably have testified before Congress more than anyone else in history. Only very recently was there that profound degree of vitriol and just hostility to public health and science that I saw. I mean, you mentioned the June hearing, when Marjorie Taylor Greene started spouting off things that I didn't have any idea what she was talking about. Yeah, that's unique. That's not the way Congress generally acts towards people, even people for whom they disagree with. This past experience with COVID has been unique, I would say, in all of my experience with the Congress.
Well, I'm sure this is a question you've gotten from Congress many times before, especially on the Zika virus when you were trying to get funding for a vaccine. And that was essentially, why are we spending money on people who aren't Americans? Why are we doing all this stuff overseas for them?
The United States is the richest country in the world. We have the best science. We have the best capabilities of developing these kinds of interventions. And I actually feel that we have somewhat of a moral responsibility because we have the capability of developing interventions that could be life-saving for people, even though these people don't live in the United States, which is the reason why President George W. Bush started the President's Malaria Initiative, and why I had the honor and the privilege of working with George W. Bush to develop and put together the PEPFAR program, the President's Emergency Plan for AIDS Relief, that was directed specifically to prevent, treat, and care for HIV in the developing world, particularly sub-Saharan Africa. And that program has already saved 25 million lives. So only the United States could have done that because of our wealth and our expertise. And I think, as I mentioned, that we have a responsibility to the rest of the world to do that if we can. And we've done it with diseases like HIV and PEPFAR and malaria.
Are there any structural changes in the NIH umbrella that you think would help to make relations with Congress better, to explain better, to make them less fraught and more informative?
Well, I hope that the NIH gets the opportunity, with the Congress and with the new administration to articulate the things that the NIH has done and is capable of doing. It's an extraordinary organization, Pat. I mean, the research that comes out of the NIH has been responsible, for the development of most of the drugs that we use that cure diseases, that treat diseases. And all of the things that come out of that is the science base that is essential to keep us healthy.
Because there have been so many threats against you, not just by ordinary citizens, but by people in a position of authority, members of Congress, would you accept a preemptive pardon from President Biden if it were offered to spare you what they might do?
I'm sorry, Pat, but I can't comment on that. That's just too sensitive an issue. I apologize.